Welcome to the General Data Protection Regulation GDPR online course. Module 5 consists of 2 lessons. Lesson 1 utilizes the case study Protecting the Rights of Data Subjects in the Provision of Health Services and aims to address the rights of the data subjects or else patients. Finally, Lesson 2 refers to the European Health Data Space and its duties. Now we continue to Lesson 1. Case Study Protecting the Rights of Data Subjects in the Provision of Health Services. The lesson objectives are identifying the rights of the data subjects patients. This lesson will help you to better safeguard patient privacy, reducing the risk of unauthorized data access or breaches, and acknowledge the importance of ethical data practices in daily healthcare activities. And lastly, seek further collaboration with data protection officers, IT professionals, legal experts, and stakeholders to ensure data protection and compliance. Data subject free request timeframe. Some important information before we continue with our lesson is that individuals have the right to request their data without being charged any fees, that if an individual requests their data, the organization must respond swiftly within 1 month after receiving the request, and the individual must be informed within 1 month of sending the request, where the organization should explain the reasons for the delay and provide an estimated time frame of the response. Scenario: in a small town, a community health clinic provides various healthcare services to the residents. The clinic recently implemented an electronic health record system to improve efficiency and enhance patient care. The EHR system allows healthcare providers to store and access patient medical records electronically. However, concerns have been raised about protecting patients' data and the rights of the data subjects. The basic rights provided for GDPR. The rights of data subjects are 1. The right to informed consent. Patients have the right to fully informed about collecting, using, and disclosing their health data. The clinic should obtain informed consent from patients before collecting their data and inform them about how their information will be used, shared, and stored within the HR system. 2. Right to access. Patients have the right to access their health data stored in the EHR system. The clinic should provide a mechanism for patients to review, obtain copies of, and request corrections to their health records, ensuring transparency and empowering patients to be actively involved in their healthcare. 3. Right to data portability. Patients should have the right to receive their health data in a structured, commonly used, and machine-readable format. This allows patients to easily transfer their data to another healthcare provider if they choose to do so, promoting continuity of care and patient autonomy. 4. Right to privacy and confidentiality. The clinic must ensure the privacy and confidentiality of patients' health data. Adequate security measures should be implemented to prevent unauthorized access, loss, or misuse of data. Healthcare providers should only access patients' data on a need-to-know basis, maintaining strict confidentiality. 5. Right to data erasure. Patients have the right to request the deletion of erasure of their health data from the EHR system under certain circumstances, such as when the data is no longer necessary or when the patient withdraws their consent. The clinic should have clear policies and procedures to address such requests promptly and securely. 6. Right to data accuracy. Right to ensure that their health data is accurate and up to date. The clinic should have mechanisms in place to verify the accuracy of the data and allow patients to request corrections or amendments if necessary. This ensures that healthcare decisions are based on reliable information. The clinic's EHR system collects and stores various types of sensitive health information, including patients' medical history, lab results, diagnosis, and treatment plans. In this case, the data subjects are the patients who receive healthcare services at the clinic. They have certain rights regarding their data which need to be protected and respected by the clinic and its healthcare providers. To mitigate the risks and ensure compliance to protect the rights of data subjects, the clinic should take the following measures: implement robust data protection policies and procedures, train healthcare providers on data privacy and security practices, encrypt sensitive health data to prevent unauthorized access, conduct regular audits and assessments of the EHR system security, obtain explicit consent from patients for data collection and use, establish a process to address patient requests regarding their data rights, comply with the applicable data protection laws such as the General Data Protection Regulation. Questionnaire. Please proceed to test your acquired knowledge with the following questionnaire. Thank you for participating in Module 5, Lesson 1.